Okay, your patient is Mrs. Khan, 28 years old, female. Come to discuss her problem with you. Take proper history and manage the patient. Examination is gray. If it is required, go ahead. Otherwise, then you don't need to proceed with that one. Okay, Dr.
Okay.
Sarah, start.
Good morning, Mrs. Khan. I'm Dr. Sarah here. How can I help you?
Doctor, I've been having this burning pain when I pass urine for the last 2 days.
Okay, all right, Miss Khan. Can you tell me more?
Doctor, I'm having this burning sensation last 2 days. Gradually, it is getting worse now. And I have to go
Mm-hmm.
to toilet every 30 to 60 minutes. I'm passing very little amount of urine.
Mm-hmm. Okay. Okay, Mrs. Khan, as you mentioned, you have burning sensation and the little matter. Is it urine comes again and again, like increase frequency also?
Yes, doctor, I told you that this is every 30 to 60 minutes I have to go and go to the toilet.
Mm-hmm. Okay. Any pain in your tummy?
You're talking no pain, doctor.
No pain. Any blood in the urine?
No, doctor.
Okay. Any fever? Do you have?
No, doctor.
No fever also. Okay. Okay. And when the urine you pass, do you feel after completing or passing the urine, do you feel still is there remaining urine?
Not such thing, doctor. But
Not such.
sometimes I can't hold that, doctor. It's very difficult for me.
I can understand. Might be very difficult for you. Any long-standing disease you have?
No, doctor.
Okay, Mrs. Khan. Any regular medication?
No, doctor.
Is this first time you had this problem, or before also you have in the past?
This is first time, doctor.
First time. Okay. Any long-standing disease in the family?
No, doctor.
No. Okay. And do you smoke, Mrs. Khan?
No, doctor.
How about alcohol?
No, doctor.
May I know your daily diet?
Doctor, I'm taking homely food actually. Most of the time, I'm taking this rice, vegetables, and meat products, doctor.
Okay, okay, right. Meat products. Okay, okay. And may I know, what is your weight? Did you check?
Doctor, my BMI is 27.
37. Okay. And
27, doctor, 27.
27, 27. Okay. What do you do for a living, Mrs. Khan?
Doctor, I'm a teacher.
How are the things at work?
It's fine going on, doctor.
Mm-hmm. Okay, that's great. With whom do you live?
Doctor, I'm living with my husband.
Okay, okay. So may I know your last period date?
Doctor, 3 weeks ago.
3 weeks ago. Are you sexually active?
Yes, doctor.
Okay. So are you using any birth control pills?
No, doctor.
Mm-hmm. Okay, okay. So, okay, what's crossing your mind?
Doctor, I think I am having some infection in my bladder.
Mm-hmm. Okay. And how about what's concerning you more?
Well, doctor, I'm worried that it might go to my kidneys if I'm ignoring.
Mm-hmm. Okay, okay. And Mrs. Khan, is this like previously before urine? Anything you feel like with this infection? Sorry, not infection, urine problem. Do you feel confusion?
No, doctor.
Okay, okay. What do you expect from me?
Doctor, I hope that you will be giving, you can give me some antibiotics so it will be easy for me to get better.
Yes, okay. I will discuss your particular issue and how this impact on daily life.
Doctor, I can't hold doctor during, so I'm teacher. So during the session, I cannot stop myself.
Yes, I want to sum up, Mrs. Khan, for you. You have this urine problem, increased burning sensation in the passing urine, and you cannot hold, as you said, and you think might be affecting my kidney also. So it's disturbing, impacting your daily life, your work also. You want from me medicines to treat the problem. Is this all?
Mhm. Yes, doctor.
Okay, can I examine you now?
Okay, doctor.
With the proper privacy of Chevron, I will sanitize my hand. I will look at your hands and I will check your temperature, pulse. Okay, and I will check your blood pressure. I will look at your eyes. Can you look up and down? Oral cavity, lumps and bumps in the neck. Can you
Hmm.
please lie down with the proper privacy of saffron?
Hmm.
Can you please unbutton your shirt? Thank you,
Hmm.
Mrs. Khan. I will look, feel, and touch your tummy slightly first. If anywhere pain, Mrs. Khan, let me know. Okay, I will touch slightly and then a little deeper lower tummy pain for the kidney. And can you please sit down? I can check for the renal punch also. Okay,
Hmm.
thank you. Thank you, Mrs. Khan. So
Okay.
for the
Examination finding, just normal abdomen, mild suprapubic tenderness. Just normal.
Mm-hmm. Okay, so Super PPT. I want to do some investigation. Is this okay with you to confirm my diagnosis?
Okay, doctor.
Okay, Mrs. Khan, I want to do urine test, CBC, CRP, and the urine test, microscopy, and the culture.
Anything else, doctor?
Culture, urine test, CRP. That's it,
Hmm.
doctor.
Anything else, doctor?
Mm-hmm. UTI.
Hmm.
Ultrasound. Ultrasound,
Anything else,
doctor.
doctor? Anything else, doctor?
I can't recall, doctor. Sorry.
Okay, urine dipstick, nitrate, leukocyte, and blood. Pregnancy test negative. Okay, rest of the investigations pending.
Doctors, like her LMP was 3 weeks back.
But anyhow, do it.
Still. Okay.
Yeah.
Okay. Okay, so from the history and examination, I'm suspecting you have a lower urinary tract infection or maybe cystitis. This is the infection of lower urinary tract, Mrs. Khan. Most probably it could be the bacterial, but for the management, it's not, I want to tell you, ma'am, like we can manage it. We have management plan. We can treat it. Are you
Hmm.
getting me? Okay.
Okay,
So
doctor.
first of all, I want to discuss with you a few things like how's your intake of water in daily routine life?
Doctor, I take very less water.
Very less. Okay. This is an important thing for this infection. If you can increase the intake of hydration or water, I can say keep the water bottle with you if you are at work, at home, so you can remember. It
Hmm.
just will help you. Even I can write down the cranberry sachet are there. These are the it will help you to clear the infection. Most probably if
Okay,
there is
doctor.
bacterial infection. Okay.
Okay, doctor.
And for the dietary, if you take more meat and these things, like avoid to take a high protein diet to make
Hmm.
a balanced diet. If you can take more fruits and vegetable, you will remain healthy also.
Okay,
There
doctor.
is, yes, with the high protein, there is a risk of further as you are concerned. You are thinking the kidney stones and these things. So better just take balanced diet.
Okay, doctor.
Okay. And if you can do a proper hygiene of your private part, like don't wipe from back to forward like properly. If you pass the urine, clean the part and the from front to back. Can you do this?
Okay, doc. Okay, doctor.
Okay. I want to see you after 3 days. If these symptoms are persisting, then maybe we'll go for the antibiotics. For this, at present, I don't think so. You need any antibiotic.
Okay,
Okay.
doctor.
You don't have at present any tummy pain as you mentioned, but I'm writing still medication diclofenac potassium 50 milligram PRN is per
Hmm.
need. Okay. Any allergies from medicine?
No, doctor.
Okay, all right. So, better, I will write down as per need. If you feel it's really hurting you, you cannot sleep, then you can take
Hmm.
it. Otherwise,
Okay,
don't need.
doctor. Okay, doctor.
Okay, and like one more thing I want to tell you, don't hold your urine. If you feel
Okay.
you have to
Okay.
go washroom, okay,
Hmm.
prolong holding the urination also may cause like it's give the bacteria to place to grow. Okay,
Yes,
when
doctor.
maybe
Okay,
because
doctor.
of your job, you're holding your urine, you're not going frequently to the washroom. Otherwise, nothing to worry about that. Anything else you want to know, Mrs.
No,
Khan?
doctor. That's all, doctor.
Okay, okay, okay. And Mrs. Khan, how about your family planning? Or any plan for children? May I know how long you are
Yes,
married?
doctor. We are planning for children now, almost now 3 years. We don't have children, doctor.
Okay, did you consult any doctor?
Yes, doctor. We consider they say that still you are too young to have the children and not yet a long period to get married. So they say just we have to wait for it.
Okay, 3 years. Okay, no problem. Did you check yourself with the doctor?
Yes, doctor, we have the consultation last month, so they say everything is fine.
Mm-hmm. Okay, okay.
But doctor, is
If
there any way, doctor, is there any way to treat myself to get
like
pregnancy success?
yes, there are so many way treatments. As you are saying, Mrs. Khan, your reports were completely fine. The doctor already have checked. Okay,
Hmm.
right? So there are some other things like so many factors affecting an infertility. I can say like maybe stress at your work, maybe you're not
Okay,
like
time up. Okay, Dr. Sarah, here you can tell the patient there are many ways to know that you can get a successful pregnancy or successful conceiving to know about your calendar. Okay, conceiving
okay,
calendar.
yes,
Okay,
yes.
second thing, this is sometime examiner want to listen something which is little bit new in the market. So it's not new in the market, but in South Asia, it's no one is doing this practice. And you can tell that you have to keep the body temperature near to, so you have to keep check your body temperature near to your, this ovulation date kind of
Ovulation,
stuff. As
mid.
yes, exactly. Okay, and those days you can try more and more this kind of thing, doctor. You can tell this whatever
Yes,
it
yes.
is possible, you can have it. Okay, but Dr.
Hmm.
Sarah, your case was flawless and there was no such thing to mention.
Doctor, just one
But,
thing. Even she's saying 3 weeks, still I will like
yes,
pregnancy
doctor,
test. I will take.
yes, doctor, I was reading today and it was mentioned any female pregnant patient, female patient with a childbearing age must do pregnancy test.
Hmm. I
Yes,
was thinking
doctor.
maybe not even 4 weeks. Oh, sorry.
Yes,
Okay.
doctor, you are right, Dr. Saira, but let me tell you, this is something new I read from there. That's the reason I was keep on saying
Hmm.
anything else, doctor, because
Yeah,
urine
yeah, yeah.
dipstick for everyone to know that any patient come with urinary tract infection or urinary tract symptoms, they have
Hmm.
to talk about
Yes.
that. Okay, so
Got it. Thank you. Very important point.
okay, yes,
Thank
doctor,
you.
and yeah, Dr. Mavish is there.
Hello,
Yes, Dr. Mavish, when is
Assalamualaikum,
your
sir.
exam? Walaikum
am
salam.
I audible?
Yes, doctor.
Sir,
Yes, doctor.
repeat any question.
Dr.
Could you repeat
Khanzada,
again, please, sir?
Dr.
I missed your voice.
Dr. Hanzada, your voice is distorted. I'm just, we will, uh, can you tell me again what you want to say, doctor?
Sir, you tell using the infection. What if I do for please
Doctor,
tell
I'm
me?
not getting you. Doctor, I'm not getting you, doctor. So you can message me in the WhatsApp, so we'll be able to answer, okay? But voice message is difficult to answer, but if possible, just type the message in our group, so we'll answer you, okay? So Dr. Mavish, you are ready?
Yes, Dr. Imran.
Okay, Dr. Mavish, your case is, give me 1 second, doctor. Okay, your case is 32 years old Mrs. Nisha Patel come to discuss her problem with you, take proper history and examination with management.
Okay.
Okay, give me 1 second, doctor. I have to put the timer for you. Okay. Okay, start.
Hello, Mrs. Nisha. My name is Dr. Mevish. How may I help you?
Doctor, I'm having fever and pain in my right side since yesterday, doctor.
Uh, all right, Mrs. Nisha, can you tell me more?
Doctor, 2 days before I was feeling that I have a burning sensation in the urine and I was frequently going to the toilet. So I thought it is maybe simple urine infection. But since yesterday, I'm getting
Okay.
this doctor high fever. My temperature is going sky high, almost 101 at home, doctor.
Okay.
Now I started
All
pain
right.
this morning, doctor.
All,
In my right side is there is a very much pain, doctor. So I can't sit, doctor.
all right. I'm sorry about your problem, Mrs. Nisha, and I'll try to sort it out accordingly. Let me ask you a few more questions, all right?
Yes, doctor.
Okay. Mrs. Nisha, it started 2 days back. The fever, is it constant?
Doctor, since yesterday fever is constant, but I had this pain, burning sensation 2 days ago, doctor.
All right. And how severe is the pain as we rate it from 0 to 10, 10 being the maximum?
Doctor, my pain is around 7, doctor.
And all right. Are you comfortable right now?
Doctor, I feel feverish chills are there, doctor. I'm feeling that
Okay.
cold. Doctor, can you give
Okay.
me
If you
something
want, please.
Can you give me some blanket, doctor?
Yeah, sure. Please take the couch and I'll check your fever right now, okay?
Sure,
Okay,
doctor.
Mrs. Nisha, this pain, is it going somewhere else?
Doctor, I just feel that this pain is staying over here and sometimes going down some to my so down area and sometimes goes towards the kidney, doctor.
Okay, and what aggravates your pain?
Doctor, when I'm just moving and I'm just bending actually.
Okay, and what relieves it?
Doctor, when I'm static, I don't feel any pain.
Okay, and any problem with your urine?
Doctor, I feel I just told you that I'm feeling burning sensation and I have frequency to go to the toilet. So I'm going here and
Okay,
after for urine.
uh, okay, and when was the last time you passed your urine?
Doctor, just half an hour in your clinic.
Okay, and is there any pus or blood in the urine?
No, doctor, I haven't seen anything.
Okay, any foul smelling?
No, doctor.
Okay, and do you have any nausea or vomiting?
Uh, yes, doctor, I have vomited twice this morning and I can tolerate only small sips of water, doctor. Nothing is staying in my
Okay.
stomach.
All right, all right. I'm sorry about that, Mrs. Aisha. I'll be giving you the right kind of first aid in a while, okay? Mrs. Aisha, are you married?
Yes, doctor.
And when was your last period?
Doctor, my period just 1 week ago.
One
And
week ago, and they're regular?
yes, doctor.
Okay. Mrs. Aisha, do you remember what were you doing when the pain started?
Doctor, just middle of the night, just I found that I got some sort of discomfort. So I woke up and I have to rush to the
Okay.
toilet. Then
All
suddenly
right.
this
And
pain started.
all right. And is there any discharge from your front passage?
No, doctor.
Okay, Mrs. Aisha, if you don't mind, can I ask you a personal question?
Sure, doctor.
Do you get any pain while getting intimate with your husband?
No, doctor.
All right. Okay. Mrs. Aisha, are you using any kind of birth control methods?
No, doctor.
Okay. Do you smoke, Mrs. Aisha?
No, doctor.
Do you drink alcohol?
No, doctor.
Any party drugs?
No, doctor.
Okay, that's good. Do you have any drug allergies?
No, doctor.
Okay. And do you have any other medical illness?
No, doctor.
All right. And are you taking any kind of medicine on a regular basis?
No, doctor. I just took the medication 6 months ago for urine infection, doctor.
Okay. All right. So it happened 6 months back as well. And Mrs. Aisha, is there any significant illness in your family?
My mother had a kidney failure, doctor, many years ago.
Oh, I'm sorry about that. All right. Mrs. Aisha, do you know your current weight according to your height?
Doctor, my BMI is 22.
Okay. Ms. Aisha, have you noticed this problem it gets whenever you get intimate with your partner?
No, doctor.
Okay. And has there been any hospital admission previously?
No, doctor.
Okay. So what's crossing your mind right now, Mrs. Aisha?
Well, doctor, maybe my urine infection gone up to my kidneys.
Mm-hmm. It could be. And what's worrying you most right now about this?
I'm worried about my kidneys. Maybe I need some hospitalization, doctor, right now.
We'll see that after getting your investigations, Mrs. Aisha. So how is this thing impacting your routine?
Doctor, I'm a housewife. I can't take care of my
Okay.
children, doctor.
All right, I see. How many kids you have?
Two kids.
All right. Okay, so let me sum up, Mrs. Nisha. You told me that you are having this pain in your right side of the kidney from last 2 days, and you've developed fever, and you're worried that this infection might affect your kidney. Do you want to add anything?
No, doctor, that's it, doctor.
Okay. Can I examine you in complete privacy, Mrs. Aisha?
Doctor, go ahead.
Okay, in the presence of chaperone, I'll start from your blood pressure and pulse on both sides. I'll check your temperature and saturation, then eyes for jaundice and pallor, any lumps or bumps in your neck.
Mhm.
Can I expose you? Like I need to see, touch your tummy. Is it okay with you?
Okay, doctor, go ahead.
So I'll sanitize my hands and I'll be inspecting it and then palpate your tummy superficially and deeply. If you have any pain, just let me know. I'll percuss it. And then I'll palpate your both kidneys and then I'll make you sit and do the renal punch.
Okay.
And I'll check the
Uh,
hydration status too.
Okay, patient look ill and flushed. Vitals, blood pressure 90/60, heart rate is 122, respiratory rate 20, temperature 39.2, and saturation 99. Okay, abdomen soft but markedly tender at right, cost of vertebral angle tenderness, and mild gardening over the right flank. Suprapubic area, mild tenderness.
Okay. All right. Mrs. Aisha, I want to run a few investigations to support my diagnosis. That's okay with you?
Go ahead, doctor.
Okay. Is there any localized redness at that area?
No, doctor.
Okay. So I want to offer you complete blood count, CRP, and ESR. Also, I want to offer you a urine culture and urine dipstick. And I want to want to refer you for the ultrasound of your
Okay,
kidney
doctor.
and
Okay,
ureter,
urine dipstick
bladder.
shows leukocyte plus full blood count, and WBC is high. Urine electrolyte is mildly deranged. CRP is 110. Culture spending.
Okay. So, Mrs. Nisha, from your history, I suspect that there could be a kidney infection involved, all right? Because of this, we called it an upper UTI. It's probably upper UTI, where the infection of your urine is ascending upwards to your kidney, okay? And right now,
Okay.
because you are quite high, your blood pressure is quite low, and
Mm.
it will be advisable that I refer you to the hospital right now so that they could start some antibiotics through your IV blood channels. All right?
Okay, doctor. So who will take care of my children, doctor? My husband is not around.
Okay, Mrs. Nisha, we can call any of your like any neighbors or your relatives, or we can activate the social services. All right, they can come up there and take care of your kids while till you get better. And after your discharge, maybe they'll discharge you after you get better, and they'll discharge you on the oral medicines like ciprofloxacin. After discharging, they might give you oral ciprofloxacin for 2 weeks. And meanwhile, I'll suggest that after your discharge, just take care of your hydration and your hygiene status. All right.
Mm.
And because this repeated infection, they are not good
Mm.
for your bladder or your kidney. So
Doctor, I'm
I'll
going
suggest
myself.
that no, I'm sending you to the this emergency,
Okay.
accompanied by my staff. Okay.
Okay,
And
doctor.
once you're discharged from there, you can come back and we can have a discussion about your hydration status and your hygiene, and I can give you a leaflet on this as well. All right.
Okay, doctor.
Okay. Do you have any more questions?
No, doctor. Thank you, doctor.
Okay. Thank you.
डॉक्टर महविश आपने you did ABCs?
No, I forgot. I had to pass the IV line.
This is a pitfall.
Yes.
Okay. Patient is on
Yes.
a pain 7 to 10. You didn't offer analgesia.
GG.
Okay. No
Right.
problem. Just you can focus on that one. Whenever there is an emergency case,
Like doctor,
please
we will
follow.
ask offer for the any pain reliever, painkiller.
Yes, doctor. And moreover,
Yes.
patient is in a fever. So paracetamol is first line. Second thing, you didn't ask about the side. Where is the pain? Patient say right side. So you just took the right side and you were keep on, getting the history idea. You should ask where is the pain. Can you tell me where
I
is the pain
asked
now?
where is the pain?
Okay. So this is doctor, and emergency means emergency. So you have to comfort the patient first. Okay. Otherwise, case is
Right.
fine. But emergency
I
means
should
emergency.
have
So
done the should I have done the like any Roxing or else to exclude appendicitis?
doctor, moreover, yes, you can see the acute appendicitis, but on the examination you already got it, and patient have one history of previous
Punch was
uncomplicated
positive.
UTI.
Yes.
Yeah.
Okay. Right.
So that is it. That's it from my side. And doctor, I have to call now the doctor. Doctor Aram Yasir is there. Doctor Saima Faruqi, when is your exam? Assalamu alaikum, doctor. Where is your exam? Okay, so Dr. Nimra, are you ready to do the case?
Yes, doctor.
Okay, Dr. Nimra, your patient is 35 years old, Mrs. Rahman. Come to discuss a problem with you. Take proper history, manage the patient. Examination is great.
Okay.
Okay,
Hello, good
Dr.
day. My name is
Nimra.
Dr. Nimra. I'm your GP today. How can I help you, Mrs. Rahman?
Doctor, I'm getting this infection again and again, doctor.
Okay, can you tell me something more about this?
Um Well, doctor, I'm having this fourth time this I had this thing happen. My burning cessation in the urine in last 6 months, doctor. And doctor treated me every time with the UTI. They give me some
Mhm.
antibiotics. And again, this problem happened, doctor. I'm just worried about what's going on with me.
Okay, I'm here to help you, Mrs. Rahman. It's very disturbing for you, I can understand. Can I ask you a few questions about your problem?
Sure, doctor.
You told me that you have the infection. Can you tell me where is the infection? Do you
Doctor,
feel any burning in your urine?
doctor, I'm having urine infection. I told you that again this urine, this burning sensation in the urine happened, doctor.
Okay, okay, okay. Is it happening now? Do you have this burning urination in these days?
Yes, doctor. It's have started yesterday again.
Okay. And in the past, how many months back it occurs?
Doctor, in last 6 months, this is fourth time.
Okay, okay. Okay. Do you have any fever?
No, doctor.
Okay. Do you need to go to the washroom after every 30 to 40 minutes?
Yes, doctor. Quite often I'm going, but I don't think so. That is 40 minutes. But I have
Hello?
to go. I have to go a lot.
Hello?
Yes, Doctor Nimra. Am I audible?
Yes,
Doctor.
yes, yes.
Yes, yes, doctor. I have
Yeah.
to go
Uh,
quite a lot, but it's not something in 30 60 minutes, doctor.
okay, okay. And do you have any fever?
No, doctor. No, doctor. I don't have fever.
Hello?
Yes, doctor. I don't have fever, doctor.
Hello?
Yes, Doctor Nimra. Hello. Dr. Nimra, look like your signal, your connection is not stable, doctor.
Hello?
Yeah, doctor.
Hello?
Yes, doctor.
I'm hearing.
Yes, doctor,
Hello?
I can
Are
hear
you?
you. Yes, doctor, I can hear you. Dr. Nimra, I think your connection is unstable. Yes,
Hello?
doctor.
Hello? Are you
Yes,
hearing
doctor.
me? Are you
Yeah, yeah,
hearing
yeah,
me?
doctor.
Yes.
Yes, doctor.
Yes. I asked you, do you have any fever, Mrs. Rahman?
No, doctor.
Okay. And do you have any tummy pain?
No, doctor.
Okay. Do you have any high blood sugar?
No, doctor.
Okay. Okay, please tell me when were your last periods?
Doctor, 2 weeks ago.
Okay. Do you have any discharge from your vagina, from your front
No,
passage?
no, doctor.
Okay. And tell me, do you have any high blood sugar, high blood pressure?
No, doctor.
Are you using any drugs for long-standing illness?
Doctor, I'm taking this COCP pill.
Okay. Okay. Do you have any history of headache?
No, doctor.
Okay. And you told me that this is the fifth time in the last 6 months you have this burning in the urine. So,
Hmm.
do you take any medicines before?
Doctor, Doctor treated me with a short antibiotic, doctor.
Okay. Okay, Mrs. Rahman, please tell me, what do you do for your living?
Doctor, I'm housewife. Housewife
Okay. Okay. And with whom do you live?
with my husband.
Okay. Do you have any children at home?
No, doctor. No,
Okay.
doctor. Yeah.
Okay. Any reason? Any reason for using birth spacing pills?
Uh,
You want to
Doctor, I
delay the
went.
pregnancy?
Yes, doctor. We are not planning for pregnancy now.
Okay. Okay. And are you using any barrier methods for protection?
No, doctor.
Okay. And tell me your weight according to your height. Do you know about it?
Doctor, my BMI is 35.
Okay. Okay. And what kind of diet you are following?
Doctor, I'm eating mostly takeaways.
Okay. Okay. And do you smoke?
No, doctor.
Okay. What is in your, do you have any idea what's happening with you?
Maybe I am not. I'm doing something wrong. Why I do
Hmm.
keep getting this thing? I don't know.
Yeah. Yes, it can be. Okay. And what is your main worry today?
Doctor, worried about long-term kidney damage and some side effects of
Mm-hmm.
antibiotic because already had a lot of antibiotics last 6 months.
Mm-hmm. And what do you expect from me? How can I help you?
Doctor, can you tell me what's going on with me?
Okay, sure. And Mrs. Rahman, please tell me how this has impacted your life that you have this having repeated infections in your urine.
Doctor, I'm tired of this thing, doctor.
Hmm.
I can't tolerate this thing again and again. And taking antibiotics, it really is nightmare for me, doctor.
Yes, it's very difficult for you. I can understand, Mrs. Rahman. Let me summarize you. You have told me so far that you have a burning sensation in urine from yesterday, but you have this from the for the fifth time in the last 6 months, and you think that it might damage your kidney, and you want to know what's going with you. Anything else you want to add in it?
No, doctor.
Okay, I want to examine you in the presence of a chaperone and proper privacy. May I?
Yes, doctor.
Okay, I will check your vitals, do general physical examination, then I will do the your abdominal examination. I will check your tummy. Okay. I will
Okay,
check the
doctor.
BP, pulse, temperature, respiratory rate, oxygen saturation. I will check the nails and eyes um, for any jaundice, pallor. Please open your mouth. I will see your tongue. Then I will just listen to the heart and come to the abdomen. I superficially palpate the abdomen. Any pain? Uh, if you have any discomfort, please tell me. Okay, then I'll deeply palpate the abdomen and do the renal punch. And I will check the legs for any edema or any skin changes. Okay. Um,
Examination
okay,
normal.
and I will also do the uh, uh, PV and PRF in the presence of a chaplain. Okay, thank
Yes,
you.
doctor.
Okay, Mrs. Rahman, I want to do some of your tests. Are you okay with them to confirm my
Sure, doctor.
diagnosis?
Go ahead, doctor.
Okay. Yes, I will do your CBC, CRP, urine dipstick, culture and sensitivity, and pregnancy test. Okay.
Okay. So, what else, doctor?
Okay. I also want to check your HbA1c.
Okay, dipstick positive for leukocytes, nitrates, and rest are pending and normal.
Okay. Okay, Mrs. Rahman, from your history and examination, I come to the conclusion that you have this repeated recurrent urinary tract infection. Okay. Are you getting my point?
Okay, doctor.
Uh, okay, so please tell me, I forget to know, what is your how many glass of water you drink daily?
Doctor, I'm taking only half liter, 1.5 liter water daily because I don't feel thirsty.
Yes, Mrs. Rahman, this is the cause that you are drinking very less water. So
Mm-hmm.
most of the things are not wash out from your kidneys and bladder. So this
Mm-hmm.
will cause the infections to grow. repeatedly. Okay, so it's my
Okay,
advice.
doctor.
Please drink at least 8 cup of water daily and hydrate yourself as much as you can. Okay, Mrs. Rahman, are you getting my point?
Oh, I
And
got it, doctor.
I'm yes, I'm giving you this tablet nitrofurantoin 100 milligram 2 times a day for 7 days. Okay, and please
Mm-hmm.
uh, complete the course, and I will complete the course of the antibiotic. It's necessary. Otherwise, if you break it in between, it will regrow because the infection is not cleared completely.
Okay, doctor.
Okay, Mrs. Rahman.
Okay, doctor.
Okay, and please maintain your good hygiene. And whenever you
Mm-hmm.
use the washroom, try to wipe from the front to back. Okay.
Okay, doctor.
Okay. And
Time up.
if you got fever.
Time up. Dr. Nimra. And for everyone, guys, this is a recurrent UTI case, very sensitive and easily getting fail scenario where you already know the diagnosis, but you have a lot of pitfalls in this scenario. Okay, let me have a little bit. I'll take your time, everyone. I'll be taking you 2 to 3 minutes on this scenario. First of all, this patient presented with 4 episodes of dysuria last 6 months, all tested and treated as a UTI with short antibiotics. Again, this patient came with dysuria last yesterday started. What was the main missing point in this patient was sexual history and okay and hygienic history. Okay, number one. Number one, why she's a married sexually active. She used to have a sexual activity 2 to 3 times weekly, and she had last week, last day, day before yesterday. Now she's wiping front to back. She should wipe front to back, but she is forgetting to do it, and she's rushing to the work, or she doing to work, and she postponed voiding. You have to ask how about your voiding habits, okay, toilet techniques, cleaning techniques, and what kind of thing that whether she is passing urine after sexual sorry activity and how much water she is drinking. She asked only one thing that about hydration status, okay, but rest everything was missed. So the thing agenda of this case was this patient was having this problem because of her husband. Okay, now in that one you have to talk a lot on this one because everything will be normal in this case. Only the thing now you have to educate the patient how why what is the reason of getting recurrent UTIs and what is the reason behind it. Okay, so in this patient examination was normal, investigation almost normal except leukocyte positive and nitrate positive maybe because of that one. So for the examiner, the risk factors we have to talk about that activity, use of spermicides and diaphragms, poor fluid intake, delayed voiding, and these are the risk factors are there. Postcoital voiding habits and vaginal atrophy, like say perimenopausal or menopausal, if not there, based on that one, constipation, pelvic organ prolapse, everything matters over here. Now for the workup, doctor, confirm the true recurrent UTI with a culture rather than versus other cause like say STI, vaginitis, or interstitial cystitis. MSU culture for each symptomatic episode, review antibiotic resistance. Consider blood glucose, HbA1c, whether even though she's not the diabetic, but you have to do it. And consider renal ultrasound and urology referral if typical is there. In this case, you can send this patient to urologist. Now let's talk about prophylaxis and prevention. You have to tell the patient, Mrs. Khan, shall we discuss some other thing about your prevention not to get urine infection so here and after? So behavioral, like say increase fluid intake, avoid delaying micturition, post-coital voiding, and front to back wiping and avoiding spermicides. Second thing, vaginal estrogen if she is having dryness. Third thing, consider patient initiated short course antibiotic at onset of symptoms or post-coital prophylaxis. That's what examiner Dr. Nimra want to listen from you. Clearly after activity. related UTI
Okay.
or low dose continuous prophylaxis for defined period, like say 3 to 6 months following local guidelines. Again, local guideline, doctor, I'm telling you guys. So you have to follow the local
Okay.
guidelines and discuss the risk factors of resistance and side effects and periodically review needed. And during the treatment, for example, now here question arises whether she should have activity or no. Okay. So there are two scenarios are there. One scenario, if like say she is having first time, second time, you can say that she should avoid. Okay, now here again, this case can arise a simple way if doctor is mentioning, for example, any doctor mentioning, I am suspecting that you are getting this infection from your husband. That is a clear-cut blunder. Okay, you can say that one. I am suspecting that this infection is a cross infection. So for that one, we have to take sample from your partner also to rule out what is the cause between this one going on. Okay, so this is important case. This is very very important case. Understand because it comes as a breaking bad news. Okay. Second thing is a infectious disease. Third thing is a gynec problem. So these are the 3 to 4 cases are there. One scenario. So please be attentive when you are taking the history of the patient. You have to ask each and every aspect. Otherwise, what will happen? So you will be missing the board. As you, Dr. Nimra. So please go through this, whatever you took the history, go through that one and read again for recurrent UTIs. Okay. This is one of the most common scenario comes in the exam, either as a woman, either as a pregnancy, either as a diabetic patient. There are three scenarios comes in a recurrent UTI. Okay, agenda will be hidden and hidden. So this is kind of a win-win situation what you are getting. You got my point, Dr. Nimra.
Yes, yes. Thank you so much.
Dr.
Yes,
Imran,
doctor.
when we have to refer the urologist or we have to do everything by ourselves?
No, first of all, we have to teach the patient and we have to tell that, okay, and by meantime, I'm giving you 2 weeks referral to know about it. And meanwhile, is it okay or may I suggest something that about your partner also to rule out because residual infection can happen from him also. Okay. If a patient is a symptomatic
Long.
doctor, if patient is a symptomatic doctor, you can do it. Okay, now I have to call Dr. Sadhika Gul.
Dr. Imran, just
Yes,
one
Dr.
thing.
Saira.
For how long? 3 months or 6 months? Every day, same 100 milligram BD. She will take nitrofurantoin.
Doctor, again, I need to check from my side. It
But we
is
will
there.
refer or we can recommend this much treatment for a long time.
No, no, we can suggest you might have to go for it, okay? But now,
Hmm.
in this way, say I might suggest, okay, it can happen. There's a possibility that you have to go to such and such medicine, and same time you add, I'm going to refer you. So what happened? You are not missing the anything, okay? So you are taking two ways,
Hmm. Okay.
okay? And
Both should.
yeah, and Dr. Nimra, again, for you, please don't ask repeated questions. Okay, repeated questions is taking your time. Your time is precious for 10 minutes.
Yes, there was a lot of interruption, so I forget some of the things.
I do agree, doctor. Everyone having their own responsibility. Someone is sitting on the job, someone taking care of the family.
Yes.
100% agree with you guys. Doctor,
Yes.
Dr. Satka, are you ready or I have to give someone else? Okay, Dr. Ghulam Nabi, are you ready?
Yes, doctor.
Yeah, Dr. Ghulam Nabi.
Hello.
Mrs.
Am I
Fat,
audible?
Mrs. Fatma, 26 years old female, come to discuss her problem with you. Take proper history, examination, gray, manage the patient. Okay. Let's put the timer, doctor.
This is age. How old she is, Doctor Imran?
26. 26, Dr. Ghulam Nabi.
Okay. May I start now?
Yes, doctor, start.
Okay. Hello, Mrs. Fatma. I am Dr. Ghulam Nabi. How may I help you?
Doctor, I'm pregnant and passing urine. While passing urine, I'm feeling burning and painful, doctor.
Okay. Can you tell me more about your condition, please?
Doctor, it's been 3 days. I'm feeling this burning sensation and the urine, and I have to rush to the toilet here and after, doctor.
Okay, 3 days. Okay. First of all, congratulations that you are pregnant. And may I know which trimester is it? How many weeks now?
Doctor, 20 weeks now.
20 weeks. Okay. Did you ever went for this condition, any doctor?
No, doctor, this is first time I'm experiencing.
Experiencing. Okay, okay. Do you have fever?
No, doctor.
Do you have vomiting?
No, doctor.
Do you have lower abdominal pain, tummy pain?
No, doctor.
Any discharge below?
No, doctor.
Okay. So, may I want to know a few more questions, Mrs. Fatma. That do you have any long-term illness?
No, doctor.
No. Okay. Can you tell me, is this your first pregnancy?
Yes, doctor.
Okay. So, may I ask you a few more questions? What do you do for a living?
Doctor, I'm a teacher.
Teacher. Okay. It's
Yes,
a
doctor.
noble job and a responsible job. Okay.
Yes, doctor.
So, I want to feel to whom you live with.
I'm living with my husband.
Okay. Everything is okay
Yes,
at home.
doctor. Yes,
I mean
doctor.
to say your husband is happy with your pregnancy.
Yes, I'm all happy because we already planning for the baby upcoming welcome.
Okay. Congratulations. It will be healthy baby for you. Okay. So, can you tell me, do you smoke, Mrs. Fatma?
No, doctor.
Do you take alcohol?
No, doctor.
Any daily basis? Are you taking any medication?
No, doctor. I'm taking only
Okay.
folic acid, doctor.
Folic acid. Are you taking daily? How milligram? How much milligram?
Doctor,
You know
doctor,
the
doctor given me doctor given me 800 gram, 800.
800. Okay. So, can you may I ask you? Now you are pregnant, but I want to ask you what will be your last menstrual period?
Doctor, my last menstrual period was 20 weeks ago. Doctor, I'm pregnant.
That time was okay. Everything is okay.
Yes, doctor.
Okay, okay. May I know your sleep?
Doctor, my sleep is good, doctor.
And what about diet?
My diet is good, doctor.
Are you taking a good water intake?
Yes, doctor.
Okay, okay. So, in your family, anyone have a long-standing illness?
No, doctor. No one.
No one. May I know your BMI according to the weight and height?
Doctor, my BMI is 25.
25. Okay. Are you following your woman doctor?
Yes, doctor.
Everything is okay?
Yes, doctor.
Okay. Can you tell me, Mrs. Fatma, do you have an idea what's going on with you?
Doctor, probably another urine infection.
Okay. Then, what worries you have too much?
Will it harm my baby?
Okay. So, what expectation from my side?
Doctor, can you give me some antibiotic?
Antibiotic. We will think about and we will discuss. Is this condition impacting your life?
Yes, doctor, I'm a bit worried about my baby.
Worried about your baby. Okay. So now, Mrs. Fatma, I'm just summarizing you. You're 26-year-old female came to me with the burning urinary symptoms you have, and there is no any blood in urine, and there is no fever. Also, this is since 3 days. Am I right?
Yes,
Okay.
yes, doctor. Yes,
And you are
Dr. Gulab
20
Nabi.
weeks, 20 weeks pregnant, and you are taking folic acid for 800 milligram according to your woman doctor. And you think this is maybe the another UTI infection, this is your area, and you are concerned that maybe uh, your baby will be harmed for this infection. You are
Yes, doctor.
expecting me to give write down for your antibiotic, and you are this condition may be impacted for your baby also. So overall, you are too much thinking about your baby. Am I right?
Yes, doctor.
Okay. May I examine you, Mrs. Fatima?
Okay, doctor.
I'm asking to my staff, sister, with the chaperone and with your privacy. Okay. So I will slightly do the general physical examination. I will check your nails, pulse, both of your hands, and check your blood pressure also. I will check your eyes for any pillar, and I will check your mouth also, any lumps and bumps in the neck also. Can you lie down, and can you expose your tummy, please?
Okay,
Okay.
doctor.
Thank you very much. I will slightly palpate your tummy. If there is pain, let me know. Okay. Then I will do the deep palpation. Okay. And I will see the fetal heart sound of that fetal heart sound also. Okay. So 20
Doctor.
weeks. It's 20 weeks. Okay.
Mm.
So can you sit down? I will just little bit give you on your left flank and right flank for the little punch. If there is pain, let me know about that. I will check your both legs swelling also.
Examination normal.
Okay. So whatever the things I want to do for a few lab tests. Also. Did you ever lab test did it before?
Yes, doctor. I did last month.
Last month that was okay. What test you did it?
Doctor, they took my urine. They took my blood. Everything normal, doctor.
Everything is normal. That was when it was
Last month.
last month. Okay, so we will just repeat urine analysis dipstick test also, and I will send this urine CS culture and sensitivity. Okay.
Mm.
Uh,
Urine,
and I will do the ultrasound also. So your
urine
well
dipstick
baby.
shows nitrate and leukocyte positive.
Okay.
Mm.
Leukocyte positive. Okay. So, Mrs. Fatima, it looks like that you have a urinary infection. Okay.
Mm.
Do you have idea about that? What is
No,
the
doctor.
thing? Okay, maybe you are not taking too much water also, and sometimes in the first to second trimester, it's coming due to the pregnancy, and maybe
Mm.
you are not taking too much water also. So this will comes like this. Okay.
Okay, doctor.
Are you with me? Okay.
Yes, doctor.
So, okay. So I am writing for you some medicine, and I'm sending these lab tests. When you bring these lab test report, maybe I will change the drugs also. For the
Okay, doctor.
meantime, I'm advising you that you have to take plenty of fluids also, and cranberry sachet I will write for you. Okay. And what else? I'm writing for you this tablet amoxil, 500 milligram, but
Mm.
500 milligram for 7 days. Okay,
Okay,
but
doctor.
when the result will come according to their local guidelines, we can change. Okay,
Okay.
but if your symptoms is okay, we will stay for this treatment also. But
Okay, doctor.
for my side, okay. And because you are 20 weeks pregnancy, but I'm asking you, what about your husband? Is okay?
Yeah, doctor, it's fine.
Okay, okay. So I'm asking, your sexual activity is going fine?
No, doctor, we are not doing anything now.
Okay, okay, that's fine. Also, okay. And I'm asking few more things about your pregnancy. You have to follow your woman doctor also. Did
Time up.
she? Okay. सेफ्टिनेटिंग गई. Okay.
Yep. Dr.
नहीं
Ghulam
होते
Nabi,
यार.
you are doing very well, but let me tell you, you're repeating the patient's statements.
La
Repeating
ilaha.
patient statements not allowed in exam.
Yes, doctor. Yes, I'm trying my best. Okay. Safety
Okay.
netting. What else I missed in my history?
You have to
Treatment,
ask this
anything?
question, whether you got this ear infection before, this kind of symptom before, you forget to ask. Okay?
Okay.
Yes.
Okay.
Past medical history you ask, obstetric history you ask, and
But is this question which you are telling me, is this any significant, any change of about this if she said yes?
yes, doctor, it will be recurrent UTI.
Uh-huh.
Second time she got it. Then we have to rule out pyelonephritis also, doctor.
Uh-huh. Okay.
You got
I
one
did the
point? Yes.
examination.
Mhm.
Okay. Okay. What about
Because
the
she's
pregnancy? I'm trying to follow her pregnancy also as I can. Yeah. Not
you know, you did good
100%.
job. In the pregnancy, you have to follow anything. How's everything is going on? How about if, like, say, there is a
Mm-hmm.
baby kicks are there, your baby kicks are available.
Mm.
You're able to get it or not? Okay, and any
Movement of baby.
discharge, any abdominal pain. These are the three
Mm.
questions you have to ask, and you should not ask anything extra, doctor.
Okay.
And
Okay.
antenatal visit. That's it. Number 4. There is no other thing.
Uh,
You should not
okay.
touch this other point because it will be wastage of time. Though you are not going for gynec case, you are going for the
Yes.
case we call it urogenital.
Okay. Anything in
Yes.
treatment? Safety netting, I
In
fully missed it. I know.
yeah, safety netic, but you have to ask about psychosocial was not proper.
What missed in psychosocial? Can you tell me, please?
Psychosocial, for example, what do you do for living? First of all, second thing, what do you do?
I
Okay,
asked.
with whom? Okay, that one you ask. I'm telling you that you can do it. This one.
Okay.
Profession you ask, food type, what kind of
Uh,
food, how much water she drinking,
right.
okay, and sanitation condition,
Water.
how she's wiping, okay, cleaning down
Okay.
below,
Okay.
yes, that is mandatory again because the wiping method also
UTI.
will be triggering this problem.
Okay. UTI. Okay. Okay.
Doctors, just one question. For
Yes,
pregnancy, we
doctor.
will refer it to the gynecologist or we will start antibiotic for 7 days, natrifuran time.
As per in AKT we did in past medicine, it says you have to start the medicine.
We can start.
Start.
Okay.
Yeah.
The patient is symptomatically is well and there is no fever, so we can start it. So until unless the labs will come.
Okay,
Yes.
Dr. Saima Said, I think is there. She was saying,
Dr. Imran, if we
this doctor.
start the antibiotics, but we have to refer the patient since she is pregnant with recurrent UTI.
Yes, doctor. We
So,
have to refer the patient. By meantime, we are doing that urine midstream urine sampling. Plus, you are going
hmm,
for sending for the culture also. Meantime, okay, to save the time.
okay.
Yes,
Recurrent, if
doctor.
there is recurrent, I think so.
Yes, doctor.
Dr. Imran, do we repeat the culture after the treatment is done in
Doctor.
pregnancy?
Yes, yes, we
Yes,
do.
yes,
We would repeat. Yes.
yes.
Okay.
Yes, Doctor Saima Said. He was saying that he wanted to do the case. Let's see. Doctor Saima, no, I think so. Doctor Shaima Said. Doctor Shaima is there.
Assalamualaikum, sir. Yes, I'm here.
Walaikum
Yeah.
salam. When is
Thanks
your
for
exam,
having me.
doctor? Doctor, when is your exam?
It's on 31st of January.
Oh, okay. Then you should have more chance, doctor. Please answer. Okay, doctor, your case, give me 1 second. I have to enter few doctors in the meeting. Then after that, I'll be giving the scenario. Okay, Dr. Sarma, your patient is a 35 years old gentleman, Mr. Khan, come to discuss his problem is you take proper history and management with examination.
All right. Hi, I'm Dr. Shaima, your GP today. Can I
Doctor,
please
give me 1 second,
confirm?
doctor. I have to put a
Oh,
timer. Okay.
sorry.
Okay, start, doctor.
Hi, I'm Dr. Shaima, your GP today. Can I please confirm your name and age?
Doctor, I'm Ali Khan and I'm 35 years old.
All right, Ali. So, how can I help you today?
Doctor, today morning I came to work and suddenly I feel that very sharp pain and very disturbing pain on my right side of my tummy. And doctor, it's going down to my down below to balls.
All
Doctor,
right.
I can't hold. Doctor, I can't sit. Doctor, I can't lie down.
Okay, Ali, are you comfortable in talking to me, or do you want me to give you something first for the pain?
Doctor, first of all, give me something to lie down. Doctor, I can't sit. Doctor,
Okay, so before giving you something, I would like to have just two quick questions. Are you allergic to any medication?
no, doctor,
And are you taking any regular medications for any reason?
no, no, doctor.
All right, Ali. So I'll give you an injection if you allow me. Is that okay with
Yes,
you?
sure, doctor.
All right, so I'll give you an injection in your muscle, and we call this drug an anti-inflammatory drug, just to help you with your pain. Is
Mm-hmm.
that okay?
Okay, doctor.
All right, Ali, and I hope you feel better after this, but it will take some time anyway.
Okay, doctor.
Okay, I would like you to have a comfortable position on the couch, and then we can continue the rest of our questions.
Sure, doctor.
Are you comfortable now?
Yes, doctor, I'm comfortable now.
All right, Ali. So, yeah, so this pain started today, as you said.
Yes,
Uh,
doctor.
has this ever happened before with you?
No, doctor, this is first time in my life.
All right. And so it started exactly when you were in office working, or when you were lifting any load or something like that?
Doctor, I'm a construction worker. So I was just started about to start my work morning. I feel that suddenly I got some heavy, and then after that pain started. I vomited, doctor. I thought maybe I'm empty stomach. After that, I went to pass urine, so I saw there's a red color urine in my in bowel.
Okay, all right, Ali. And so how many times you have vomited so far?
Doctor, 3 times I vomited without any reason, doctor.
Okay, and what was coming in your vomit?
Only water.
Only water. Okay, and I would also like to know, Ali, that uh, how is your habit with the water intake? Are you taking enough water these days?
Doctor, working inside is really hot over there. So it's difficult for me to consume a lot of water because toilet is not nearby.
Oh, so you probably have to maybe hold your urine for longer times. Is that correct?
Yes, doctor.
All right, Ali, I'm really sorry to hear that. And do you have any long-standing medical illnesses?
Like what, doctor?
Uh, any history of any high blood sugars,
No, doctor.
any high blood pressure?
Uh, no, doctor.
Okay, and any such history in your family?
No, doctor.
Any other history of maybe kidney disease or anything else?
Doctor, my father had a renal failure, kidney failure, doctor.
Oh, okay, I'm sorry to hear that. All right, Ali, did you notice any fever?
No, doctor, I feel that I'm feeling hot inside. But your nurse told me that I don't have fever.
Okay, all right. And I'll just like to ask some quick personal questions if that's okay, Ali.
So, doctor.
All right, are you married?
No, doctor.
Okay, and are you sexually active?
No, doctor.
All right. And do you smoke?
No, doctor.
And any other addictions, alcohol,
No, doctor.
or any addiction to any other medication?
No, doctor.
All right, Ali. And What's in your mind? What's concerning you the most regarding this pain?
Doctor, just worried about maybe I will get. I'm having some kidney infection.
Mm-hmm. All right, Ali. So let's have a look. Um, if you allow me, we can have a chaperone, and then I would quickly assess you if that's okay.
Sure, doctor.
Sorry?
Sure, sure. Go ahead, doctor.
All right. So I'll just have a quick review with your general physical examination, in which I'll look into your eyes, your hands, your palms, your tongue, and below your tongue. And
Okay.
then I'll quickly check your heart rate, blood pressure,
Mm-hmm.
and I'll have a look at your tummy. First on the top, if you're okay, if you feel any pain anywhere, just stop me right there. Okay?
Sure, sure, doctor.
All right, Ali. So from my examination and from whatever you
Okay.
have told me,
Examination finding shows temperature normal, blood pressure normal, abdomen soft, tenderness or right lower quadrant, along with suprapubic tenderness.
all right. Okay, thanks for telling me that. So Ali, so far whatever you have told me and from examination, I think you may be suffering from renal stones, like a
Mm-hmm.
kidney stone,
Mm-hmm.
and you might have passed a kidney stone earlier with that pain as well.
Mm-hmm.
Now see, there are multiple factors to it. You don't have to worry. It's a treatable condition,
Mm-hmm.
and we can take it from there with some investigations. Are you okay in doing that?
Sure, doctor.
Okay. And so, first of all, coming to your normal routine life, you need to drink water, which is very,
Mm-hmm.
very important
Mm-hmm.
in order to flush any kidney stones which are there, because some stones are very small and we can flush them um, with the good intake of water. All
Mm-hmm.
right. Now I understand with the nature of your job, it's something uh, I would say if you can do anything, to avoid very hot weathers or um, things like that. The other
Mm-hmm.
thing is I would like to investigate you for your urine first.
Okay,
I'll
doctor.
send your uh, urinalysis as well as your culture, which will show if there's any bacteria there.
Anything else, doctor?
Yes, I would like to, if that's okay with you, we need a scan as well for your
Okay,
kidneys.
doctor. Okay,
So
doctor.
first, it may be an ultrasound, but we might have to progress to CT scan. So
Mm-hmm.
basically, CT scan is a bigger sort of bigger thing, like an X-ray, and it shows exactly,
Mm-hmm.
uh, the details with the stones.
Mm-hmm.
Okay, and
Okay, doctor.
I would like to refer you as well for further management and observation. Is there
Doctor, when
anyone
I
with
will
you?
go?
Sorry?
When I'm going for that when I'm going to the specialist? When I will go
Well,
to the
I have to
specialist?
refer you now, Ali. I have to refer you now.
Okay, but doctor, my pain is settled.
Your pain is settled now?
Yes, doctor.
Okay, so you're completely pain-free at the moment. Am I
Yes,
correct?
doctor. Yes, doctor.
Okay, Ali, we still have to send an urgent referral in order to get your investigations. And by urgent referral, I mean within 1 or 2 weeks' time.
Okay, doctor.
Will that be okay with you, Ali, to do all of this?
Sure, doctor.
Okay. And for now, I'll give you some other pain relief as well
What?
for home, which will
Oh,
be, sorry.
okay, doctor. Go ahead, doctor.
Yeah. So I would like to give you a tablet diclofenac. It is an anti-inflammatory.
Mm-hmm.
So you can take it 50 milligrams once in a day, once at
Mm-hmm.
night, after meals, ideally, because it may
Mm-hmm.
cause some stomach disturbance.
Mm-hmm.
At the same time, I would like to advise some stomach protector that will be capsule omeprazole. It will just protect your stomach from the anti-inflammatory effects, okay? And that is
Time
20
up.
milli. Okay. Thank you.
Okay, Dr. Sama, this is the first interaction with me so far. Let me give you in a little bit detailed way. First of all, when patient is in the pain, you have to ask about Socrates properly. Site, okay, onset, okay, and then you have to start with Socrates based on that one. And third thing, you did a good thing that you initially start asked about a drug allergy and taking any drugs. That is wonderful thing. But when patient is asking you something, you have to be more comfortable, make the patient more comfortable and show the aggressiveness while patient is in the pain. The pain score was missed. Okay. And apart from that, when you're taking psychosocial history would be proper way. Because examiner, they don't like the psychosocial history should be upside down. Means like say if I'm talking what do you do for living and after that I forget to ask with whom you live. Okay, what kind of diet you're taking. Okay, and what is your BMI, smoking, alcohol. This thing should be in a one line rather than just moving here and there. Okay. Third thing, in your scenario, you're going through and through, but dipstick is the more mandatory part in this one, not a urine culture and sensitivity. So you have to tell first of all, because on your examination table, there will be a urine dipstick, bottle will be there, small. Okay. So you have to see that one, you have to hold that one, or you have to touch that one, or you can verbalize that I'm going to do the urine dipstick. Then examiner will give you the that his or her investigation finding. If he's not giving that, it will be considering, oh, it is a normal, but actually it is not normal. Since you didn't perform that one, so examiner didn't giving you the finding. Am I right? So this thing you have to be extra cautious when you are taking the history of the patient, okay? And when you're explaining, your management is very wonderful. I must say that you are well prepared, but you are a bit slow in a way. Second thing, you have to follow the protocols. Socrates is more important, and for child patient, for your information, you have to ask about birth history, immunization, patient nutrition, and developmental programs, whatever, so on, based on the age. Okay, up till age of 7, I think so. They are asking 7 or 14, but I'm not sure. Please be confirm on that side. And for the flex, if there is a female patient list, they are asked if she is a pregnant or if she is not a pregnant. Both way LNP is more important, and then followed by if she is a pregnant. So you have to ask about how pregnancy going so far. Okay. If like say elderly male is there or elderly female is there, so you have to ask few things that is which is related to history of fall. Like say any chronic medication usage, how about the joints and other problems, any urine problems. So you have to ask about it. Okay. If patient having some sort of drowsiness and dizziness, this is the most common scenario come with the drug sulfonylurea or some other drugs. Like say elderly patient comes with a BPH and you are giving alpha blocker. Patient age is 75. You did a wonderful job with taking the history. You did a wonderful job with examination, management, everything. Once you given this alpha blocker, examiner will fail you. The reason, you know why? Because you is patient having risk of fall. Morse scale or whatever. I don't know what is the name. They did do it. Okay. So what we have to think about now to about how we are going to deal and who to whom we are going to deal. Okay, your case was superb. There was no such thing. You are thoroughly patient centered. You are not a judgmental. That is a positive point. But when you're talking about Socrates, if you are not interpreted correctly, you might lose the station, doctor. Okay. Patient come with the pain. May I know where is the pain? Simple question to start from there, and suddenly you will be getting narrowed diagnosis. Okay, that window. Or in that window, you might have one or two diagnoses, and then you can take faster history, and you will be getting one diagnosis. And diagnosis now you're going to fill that only tick marks, like say past history, drug history, family history, eyes, and so on. Your eyes was not there. Okay. So ice was not complete. Impact was not there. Addressing the eyes is more important again. So please be focused on that one. It will be more, beneficial for your upcoming exam, inshallah, on 31st. So it will be more helpful for you. Simple way, you
Dr.
are doing
Imran,
good. Yes, doctor.
sorry to interrupt you. Two questions. Number one, in this patient, we have to do a spiral CT within 24 hours, no matter what,
Hmm.
if the pain is relieved or not. Am I right?
Hmm. Hmm.
See,
Okay,
and the
there
sec
is one.
hmm,
Sorry, continue. Then I'll tell you.
okay. And the second question, कि alpha blockers क्यों नहीं देने? Like, why would they fail us? If there is elderly patient, yeah, it depends on, like, it applies on every patient.
No, doctor. When there is a risk of fall, elderly patient
Yeah,
having
okay.
more risk of fall. Okay.
Okay, okay.
Second thing, spiral CT, I'm telling you told about. There are two scenarios might arise. One scenario will arise in a way patient you given the painkiller medication, you did ABC on the spot, patient settled. Now you can send this patient for 2 weeks referral, no matter what. Okay, should not go for spiral CT. That is my observation. Okay, if someone having more information, please correct. Second thing, if patient pain is not settled. Patient said, my pain is still going on after 1 hour. I'm saying that, okay, I'm giving you, Mr. Kamal, I'm giving you this injection, and within 1 hour, your pain will be settled. If not settling down, we will go with another plan. So, this thing, if you're verbalizing that, examiner will know that you know how aggressively and how, a focused approach you are going to follow. So, examiner will pass you at that point. He whatever you are doing now, it is secondary for him. The reason because he know that if patient pain settle, doctor knows what he is going to do. If patient pain not settle, what he is going to do now. For example, after giving injection, patient pain is not settled. It means there is obstructive going on. Obstruction is going on. Am I right? Now this patient go immediately to the hospital. No matter what. Again, but patient pain settled. Okay, patient don't have any problem. Patient don't have hemodynamically instability. Patient is a young, so you can send a patient with referral painkillers, and you can give the safety netting, and that's it, doctor.
Okay, sir, I will check, but as far as my knowledge is, even if the pain settles, we have to conduct a spiral CT because if the patient develops fever, there is risk of sepsis or
We
obstruction.
we are not. This is if like it happened first time. This patient doesn't have. This does not have recurrent issue, doctor.
Okay, okay, that makes
Okay,
sense. Yeah, okay,
and just within 6 hours, doctor.
okay, okay.
Okay, and we are giving window of 24 to 48 hours to see.
Hmm.
Yes,
Okay.
doctor. Okay. So yes, your concern is very valid and more potent. Okay. But important thing again, what we have to see how we are going to deal at the GP level. Spiral CT, I haven't heard because this case, what I took from here, I given to Dr. Shaima, that was done in MRCGP South Asia orientation program in Abu Dhabi in my session in August actually in 2025. This scenario I took from there. Okay, because this scenario mostly comes in exam, so that's the reason I given you guys.
Sir, one more question. If the pain has settled, then we have to refer to urologist in how much time? Like in 2 weeks time or urgent
2 weeks
referral?
time.
Like 2 weeks time. Okay.
Yeah.
Okay, Dr. Imran, I just have two questions.
Yes,
Thank
doctor.
you so much, first of all, for very thorough feedback. That's very helpful. The second thing is, if like when the patient came and he like told me exactly, from where the pain is arising and where it is going, do we still have to specify the site when he's already telling this to us? And
No, yeah,
uh,
yes, yes.
and the sorry, and the other thing is uh obviously I've been seeing different videos from different professors and things, and obviously you are there as well. So they usually say that uh like the concerns are the most important part of ice, even if you're missing, because
Hmm.
obviously if the patient is in pain, and it's always a situational thing. That's what I was just wondering, but if there's anything I could correct about it, so yes, you can guide,
Yes,
please. Thank you.
yes, doctor. Let's talk about ICE as you mentioned. For everyone, ICE is as important as patient HOPI. Okay, now patient have this thinking that he or she is having tumor, like his father, for example. But on the examination and investigation, you found out he or she is having simple ureteric stone. Hmm? One thing. So here you are going to tell Mr. Khan, as you are thinking that this is a tumor. Good news is that one, it is not a tumor. It is a kidney stone. Have you have idea about what kidney stone or ureteric stone? No, doctor. This is stone means like it's been formed due to many reasons. Sometimes because of the diet, and since you are the working in a hot area, so you're taking the more less water intake, and you are as per your demand. That's the reason you're getting concentrated urine. So that's the reason your kidneys forming the stone formation. Okay, or concentrations. Okay, due to that concentration, you got this pain. You're getting me, Mr. Khan? So now, first of all, you have to address non-pharmacology. You have to start. Tell him to go for a hydration, not to consume those things that which is making the kidney stones. Like say, red meat is there, cabbage is there, spinach is there, beetroot is there, cheese, egg yolk, and what you call it, what tomato is there. So this kind of thing you have to. You can mention anything, one or two things. Okay, not to put whole line. Okay, and encourage him to take a lot of water, and you have to encourage to take him to include vegetable, sorry, in the vegetable he have to include the carrot and radish. Okay. Third thing, now let's talk about the Mr. Kamal. Let's talk about the pain and other things. Okay. First of all, since you're now you're pain free, so look like now if you're feeling much better. Either you pass the urine kidney stone or not. So for that one, I'm giving you medication. If in case if you're getting the pain, so you can take this tablet diclofenac potassium 50 microgram, and you can give urine alkalinizer. Okay. Either it is a sodium citrate or sorry sodium citrate and potassium citrate, whatever, so on. So you can give. Now, Mr. Khan, in case within 24 to 48 hours after taking this medication, also if your pain is not subsiding and you're getting feverish, you feel that you're passing less urine, please consult to emergency department without any delay. Are you getting me, Mr. Khan? Is there any question you want to ask? Doctor, can you tell me, uh, will it be a kidney failure? No, Mr. Khan, it is not. It cannot be kidney failure. You're concerned that you might be kidney failure. No, it is not a kidney failure. Okay, and yes, of course, it is impacting your work pattern, work because you're working in the hot areas. So it is my suggestion. Is it okay to follow for you if I'm suggesting you anything? Yeah, please hydrate yourself. That is the most important part for you at the point. Okay. In this case was the profession was highlighted as a construction worker. But second case arise the patient is taking junk food more, like the cheese, burger, pizza, anything. So patient might get amorphous ureate stone. Amorphous ureate stone always come with a protein or junk food. Okay, calcium oxalate stone mostly comes with the dehydration or some sort of immunocompromised condition like say hyper and hypothyroidism. Okay, so both you have to rule out as at the point. But the thing at GP level, you have to think or as a GP on the basic way within 10 minutes what you can do it. Okay, no need to go with a high end thing that where patient catch you and you ask you some other questions. So if patient started cross questioning, no doctor, it will be wastage of time. Okay, it happened in my exam with a body dysmorphic disorder case was there, and she started cross questioning because I did a mistake. But luckily, I survived. I don't know whether it was it what happened there, but luckily I survived. The reason because if you say anything specialized, patient will catch you. Okay, so go with a basic and go with in a way that it should be easy to understand by the patient, and it should be patient centered, not as a judgmental. Yes, doctor. Yes, doctor, it's
Thank you
recording and
so
doctor.
much, Dr. Imran.
Yes, doctor. Doctor, Hure, Jalna, these things there. Okay, doctor, I'll be telling you this on a recurrent UTI, this one in my message because we're running short of time. I have one or two scenarios with me. Dr. Iram Yasir is there. Who else having the exam on 31st, 1st and 2nd and 3rd? Okay, Dr. Iram Qureshi, are you ready for the session or case?
I have one.
Okay, okay, Dr. Hironi,
Yes, sir.
are you ready? Yeah, Dr. Iram, after that one, I will give Dr. Hironi to do the case. Okay, for you, there is a case of, give me 1 minute, doctor. Give me 1 second, doctor, and my case is a little bit distorted. For Dr. Recurrent UTI, I always think that this patient need a lot to talk and lot to ask. Okay, so shorten your sentences and ask more questions. Second thing, only few things are confidential, but nothing is more confidential. Only that relationship with husband, wife, and partner is confidential. Rest everything, like say asking about alcohol, asking about smoking, asking about recreational drug, the thing is confidential. Okay, so no need to ask for the permission. So this is by the MRCGP or examiners. They say that this is nothing is confidential other than this one. For that one, you have to take the permission. Rest everything knows everyone is doing. Okay. So and my sister giving. Okay, doctor. Iram, your patient is Mr. Abdurrahman, 62 years old, a taxi driver. Come to discuss his problem with you. Take proper history, examination, and management plan, doctor.
Okay.
Okay, Dr. Iram, start.
Uh, Hello, Mr. Rahman. I'm Dr. Aram. How can I help you today?
Doctor, I have seen blood in my urine and it's really scared me.
Okay, tell me more about that.
Doctor, since yesterday morning in my urine, I found this blood has been red and like a tea color. And every time I pass urine, I'm getting the same thing, doctor.
Okay, Mr. Rahman, it is from starting of urine or in mid of urine you pass a blood.
Doctor, just I noticed in my bowel.
Okay, and it is
The
fresh
whole,
red.
doctor, it's a whole stream, whole stream look like red and dark.
Okay, and do you have any pain with this?
Uh, Doctor, it's not painful at all, doctor.
Okay, do you have any fever?
No, doctor.
Okay, and do you, okay, have you pass any clots?
No, doctor.
Okay, and how much do you go more in passing a urine?
Doctor, I'm scared to go to pass urine because if I'm passing urine like this, so my whole blood will wash away from my body.
Okay, do you have any tummy pain?
No, doctor.
Do you have any history of a stone pass during urine?
Never, doctor.
Okay, do you have any weight loss?
Doctor, weight loss, I don't know because I noticed that my shirts are getting, shorter, sorry, bigger.
Okay, did you notice your urine is stream is poor?
No, doctor, my urine stream is good.
Okay, do you feel any flank pain?
No, doctor.
Any joint pain?
No, doctor.
Any muscle pain?
No, doctor.
Okay. Mr. Rahman, do you have any long-standing illness?
Yes, doctor.
What blood pressure?
Doctor, I am having blood pressure almost 10 years. I'm taking this tablet, amlodipine 5 mg. And diabetics in 6 years. Borderline control is there, doctor. I'm taking this metformin twice daily, 1 gram. And doctor, as per my age, doctor started this Atorvastatin 20 mg at night time. And last 6 months, doctor, I've just noticed that sometimes I'm getting the back pain. So I'm taking this over-the-counter ibuprofen tablet. I'm taking. That's it, doctor.
Okay. Do you have any or blood thinner, any Ascard, Disprin?
No, doctor.
Okay. Okay. Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
What do you do for living?
Doctor, I'm a taxi driver.
Okay. And how's the thing at work?
Work is stressful, doctor. Nowadays, we are not getting much, customers.
Okay. And who live with you?
Doctor, I'm living with my wife.
Okay. How's the thing at home?
Doctor, good, all good.
Okay. I ask few personal question. Are you sexually active?
Yes, doctor.
Do you feel any problem during sex?
Not really, doctor.
Okay. And do you have any family history of similar problem, just like blood in urine, any
No, no, doctor.
any renal stone?
No, doctor.
Okay. And Mr. Ahmed, okay, Mr. Ahmed, do you have any idea what is running on?
Doctor, at first I thought maybe it's an infection or maybe some blood pressure medic because of the blood pressure medicines.
Okay. And do you have any specific worries for that?
Doctor, I'm just worried. Maybe I will be having some cancer, like my friend had a cancer.
Okay. And what do you want to expect for me today consultation?
I'm hoping that you could tell me that what's going on and maybe some test quickly.
Okay, okay. Mr. Ahmed, sorry, I forgotten. Did you travel recently?
No, doctor.
And what type of diet you are taking?
Homemade doctor. Homemade doctor.
Okay. As you said that, Mr. Ahmed, yes, you have a blood in urine and
Mhm.
it is painless, and you are worried about that. As your friend has a cancer, you could be. Anything else you want?
No, doctor. That's it, doctor.
Okay, Mr. Rahman, I would like to examine you. It's okay with you?
What examination, doctor?
Pulse, PP, temperature, BMI, and also I would like to, can you expose your tummy in complete privacy and chevron? I would like to examine your tummy. It's okay with you?
Sure, doctor.
I would like to superficial palpation and then deep, and see the abdomen, and also do the flank and renal punch, and do
Mm.
the palpate the bladder, and I
Mm.
also do the per rectal examination. Would it
Okay. Examination says BMI 27. Everything is normal except prostate moderately enlarged, smooth surface without nodules, non-tender.
okay? Mr. Ahmed, for confirmation of my diagnosis, I would like to do some lab tests. It's okay with you?
Okay, doctor.
I like to do urine dipstick complete blood counts, and also do the ultrasound of your kidney and bladder, and pre and post void urine.
Okay, urine dipstick shows blood 3 plus, protein trace, nitrate negative, leukocyte negative, glucose consistent, sorry, is high plus, and red plus cells in urine analysis, red plus cell numerous, white cells none, no cast or crystals, no bacteria seen, culture pending. Rest of the blood
Thank you.
investigation shows EGFR 80, Creatinine normal, HbA1c 7.8, full blood count normal.
Okay, and you said that nitrate is negative?
Nitrate in negative, yes, negative.
Okay, Mr. Ahmed, from your history and examination on some blood tests, it could be because of it is a prostate enlargement. Did you know about that? It is a benign prostate hyperplasia. Because of this, you have a blood in urine. Prostate,
Really, doctor?
do you ever heard about it?
No, doctor, this is first time hearing something prostate.
It is a gland which is like lie on the bladder neck. When it is enlarged, it press the bladder and sometimes causes the symptoms of urinary frequency and also the some blood in urine.
Okay, doctor.
Are you getting my point? I would like to refer you to the specialist, to the urologist to see
Okay.
the further investigation. And
Mm-hmm.
meanwhile, as you take a brufen, which is sometime it call the tummy upset and call the increase in bleeding. So I would like to advise you to stop there. And your main concern you has your friend has a cancer, and you could be from history. I would like to do the some more test for confirmation, and
Mm-hmm.
because your age and having blood in urine. uh,
Time up. Okay, Dr. Era. Patient had a weight loss. Patient had a low back pain.
yes.
What do you think about? Is it a BPH?
No, sir, could be a malignancy.
Max
So
metastasis.
how? Okay. So how you will manage? How you will explain to the patient in one line or two line, doctor? Is it okay for you to explain?
Uh, no, sir,
Because this is a
Mr.
partially breaking, it is a breaking bad news kind of stuff. If you straight away said bladder carcinoma or some sort of CA, definitely examiner will not tolerate these words and he will be fainting. Okay, so please, anyone having explanation, anyone can explain.
Assalamu alaikum,
Mr.
Welcome, Dr. Iqbal. Yes, Dr. Iqbal.
Assalamu alaikum, doctor. Very nice to listen, all of you. Actually, this patient is a person 50 plus years and have backache with the frank hematuria. Frank
Hmm.
hematuria comes either in the transitional carcinoma of the bladder or maybe is EGFR, I think, as far as I remember, you told 18, 1-8.
80.
80. Okay. Because I was thinking maybe, and second thing is that he's taking ibuprofen since long. Maybe this factor is there.
Yes, doctor, but he started back pain first, and for that, over the counter, he took the ibuprofen. Okay, so
Yes.
now with weight loss, with back pain, so how you are going to explain to the patient what it is and how you're going to deal with, can you describe, doctor?
Actually, I was thinking that according to this age and frank hematuria, this patient is going towards CA, especially the bladder, CA bladder. Second thing, if he has a pain, then it might be he's using the AC inhibitor also. Maybe interstitial nephritis is there, or renal artery stenosis is there. Many
I do
possibilities
agree.
are there.
Agree, doctor, but for now, examiner want to listen how you are explaining to the patient.
Actually, this patient should be referred to further
No,
evaluation
but how
to
how you
urgent
will
basis.
tell? How you will tell, doctor?
I will tell that I'm very suspicious, Mr. Zaid, that you have this bleeding in your urine. It might be for many causes in my mind right now, but I think that according to your age and you have given also history of the weight loss, I'm thinking that it might be something dangerous. So for the evolution of this thing, I'm referring to you with with this one, I will send to you the ultrasound or scan, whatever the available, with certain the inflammatory and carcinogen markers as well.
Mm-hmm. No, doctor. You
So
know why?
basically,
Yeah, Dr. Shahid, please.
so basically, I think is a case of breaking bad news at this point. So
Hmm.
you need to actually tell the patient that the symptoms you have told me, they are something serious,
Hmm.
and then you take a pause, and then
Hmm.
after that, you can break the news that I can think that that might be a cancer in your bladder, and then
Doctor,
obviously.
no. Doctor, no.
How you can tell before you don't have any
Doctor,
pain? You
Dr.
cannot
Shahid,
give
Dr. Shahid.
breaking bad news like so. You cannot
No,
give.
Dr. Shahid, let me tell you, I will give you example. Sorry for my cutting. Okay,
Sure, sure, sure,
distracting.
sure.
Let me tell you. There was a one case happened. I given that to those old colleagues over here. They told that there was one examiner given a scenario.
Mhm.
I know one of our doctor colleague in orientation program.
Mm.
Patient, 65 years old gentleman, smoker, history of weight loss, came with a dry cough. He did examination. On the examination, and he did some X-ray. Examination shows that reduce what you call it, dullness. There was
Mhm.
okay, reduced dullness. Sorry,
Mhm.
so there was no less dullness over that right lower lung area, and the chest X-ray shows some sort of mass. He said, "I'm suspecting you to have a cancer." Examiner straight away said, "Doctor, you are fail." He
Really?
didn't, yes, he said fail. He said, "Doctor, this is not a diagnostic thing to tell about the patient. This is a cancer. Obesity doesn't mean that it is a cancer. To rule out further, you have to send to the specialist, let him break the bad news. From this one, you have to tell the way. Mr. Khan, on your examination of your lung and on the X-ray finding, I found that something is suspicious, as Dr. Iqbal was saying. To rule out further, I am referring you to the specialist, okay, to rule out further what's going on with you. This is the softest word to tell the patient rather than breaking the bad news in this way. Because Dr. Shahid, I have a couple of couple of examples in my circle. Though doctors failed in the exam because of this one, doctor.
Okay, so let me
Yes,
explain to you,
yes, doctor.
because I have examples from the NHS. Okay,
Yes,
so
yeah.
what actually happened when you generate a 2 week referral pathway?
Hmm.
So we need to tick a box. Did you tell the patient that it might be a suspected cancer before sending the 2 week referral pathway?
Got
Because
it.
when
Hmm.
the patient get to the specialist and they tell the diagnosis, he will be shocked. Why you are sending me for this test, and why I wasn't told before that I'm being tested for cancer. This is a very clear guideline in the NHS. You have to tell
Yes.
the patient before generating a 2 week referral pathway.
Sorry, Dr. Shahid, I
Doctor,
interrupt
doctor,
you.
doctor,
I
Dr.
Dr.
work
Shahid,
with the
Imran.
NHS as well.
yes, doctor.
They did not say like this. They say that if you have sure or you have a sure report, for example, Barrett grade 5, you have, then you can sure. But even Barrett 4, in which malignancy chance is only 2%, you cannot say clearly. You can give him a hint that it might be possible with
Yes,
differentials, but not
Yes, and
say that
doctor.
this is
yes, yes.
cancer
That I
without
Yes,
any
agree.
report.
doctor, sorry, interrupting you again. Let me tell you, doctor. First of all, this thing happened again. There is one more example I'm telling you,
Mhm.
doctor. First of all, MRCGP South Asia is the exam for South Asia. Am I right?
That's
So
correct.
now,
Yes.
yes, NHS, you guys are referring this patient to what you call it for smoking cessation clinic. Am I right? Okay, so examiner in the South Asia, they wanted to listen. They said clearly over here, there is no smoking cessation in clinic in in Pakistan, India, Bangladesh, or Sri Lanka.
Mhm.
Okay,
Yeah.
so now the smoking cessation, for example, is case is there. You are telling that I'm going to send you to smoking cessation clinic.
Mhm.
It means you don't know about the demographic area values. Okay, you don't know about the area. You got my point. So they say that you have to make sure whatever the thing you are telling, it should be as a local guidelines, not as some guidelines you have to follow international guidelines, but there are a lot of local guidelines you have to follow. For now, Dr. Iqbal rightly said, here you are not going to touch this point at the GP level. Yes, NHS, we have to wait for lot of time for to see the GP or some sort of operation, because one of my uncle, he waited for his knee surgery, knee fracture, and he went to the Pakistan. They given 6 month waiting period. Okay, Pakistan, he went same day he got operated over there. My question, I'm not discussing, I'm not here to discuss the thing. I'm here to discuss about the thing to see the local guidelines. You are right on your way. Wonderful thing that we have to follow. But what is happening here? What exam we are giving? We are giving MRCGP South Asia. Am I right? So
Yes,
here,
yes.
yes.
I agree that you shouldn't tell the diagnosis, but you can warn him, warning shot that I am
No, doctor.
suspecting.
No, doctor. No, doctor. No, doctor. This is the one. They again. They told. They mentioned clearly in their orientation program, because there are a lot of things being discussed over there, and believe me, it's really sometimes is we got shocked. Okay, that you know that older time when there was no something was there, cholecystitis patient, they used to see the Boas sign. You know the Boas sign. No one does this time because we have ultrasound.
Okay.
Okay, so they are talking about this thing, doctor. The reason, because they know that from where we belong, the for which country this exam is for. Though name is MRCGP International South Asia, but they are following the guidelines. Belongs to South Asia. It's a same thing happening in Dubai. MRCGP Dubai totally different from South Asia. The
I
reason,
think it's
because they have.
primarily is the infectious diseases. They
Dr.
are
Iman,
different.
I have a question that when we say that yes, it is suspicious looking for me and I am worried about your health and I'm referring you to specialist. If SP say, am I having a cancer? Then how should we proceed at
Yes,
that
Okay,
moment?
at this
that's
point,
correct.
okay, you can say at this point, you can say that again. I'm quoting them. I'm not taking anything from my side. Word by word, I'm quoting. Yes, Mr. Khan. Bit suspicious doesn't mean that you have something that what you're talking about. To get confirmed diagnosis, we need to rule out. We need to do some further investigation. Are you getting me, Mr. Khan? Okay, now Mr. Khan is going to understand about this thing. Now we are going to tell, okay, Mr. Khan, I'm going to send you to the urologist. There he will be running few more investigation. Like what, doctor? Okay, you can talk about, for example, any cystography or whatever so on you are talking about based on condition of the patient. That examiner want to listen that what you're going to do. Again, I will
Okay,
add
thank
one
you.
more thing here, one scenario. Sorry, I'm again adding one more scenario. One other patient with a varicose vein in August exam was there, and primary management by the GP is what? Stalking, am I right?
Stalking, yes.
Yes. She didn't mention that she used stalking. And doctor started, okay, doctor, I'm going to, no, Mrs. Taslim, I'm going to give you this stalking. Doctor, give me something different. I already wore this one and I'm tired of this thing. Now, doctor took the pass because she knows only the primary thing, but she don't know about what is the secondary to give. Okay, so now the examiner making the preparation as in a way that you should know what's going on that one. For example, you are telling that I'm going to send to the surgery. You know, you will get clearly fail. The reason, you know why? Because patient says, doctor, I'm scared of the knife. Now you have to talk about sclerotherapy or something, whatever so on, or the treatment is non-invasive. Okay, so you have to talk about that one. There is nothing such to harm. I'm going to send for this therapy. So if you are telling this patient this thing to the examiner, so examiner they want to know how collectively how good you are using what you call it in your words. Word selection is more important. Breaking bad news is not as simple. It is not a simple, doctor. It is really, taking, breathe from our soul.
Of course, of course. Yeah, I do
Yes.
understand. Yes.
You're
But
right.
obviously, if the patient asks, like I said, so am I getting cancer? So you still say, no, I'm not sure. But you inside, you know there is something
Yeah.
very big going on, because
But I'm
he's
yes,
passing
I'm
urine,
suspecting.
and
Yes.
he has a back pain, and he's elderly, he's 50 plus, I believe, and you are suspecting something sinister.
Yes, doctor.
So are we hiding something from the patient? Patient has autonomy to know what's going
Yes,
on.
but the thing, for example, doctor, on the basis of this one, if you cannot give anything, no. Like I'm putting up one more scenario, one of the most common scenario in the exam again, hepatitis B.
Yes.
Okay, scenario come as a IgG positive. Patient come given for some sort of screening test for job, for medical purpose, whatever so on. Patient is thinking that patient having IgG. Agenda of the case to manage the patient. How are you going to manage the patient, Dr. Shahid, now to you?
So he has IgG.
Yes.
No. What is the scenario basically?
Doctor, he's a kind of, scenario like, for example, he's a healthy person. He didn't have anything. He wanted to go to some other country. For the visa purpose, they did some investigation to rule out any some sort of, infections.
Right.
Okay. They found out that this patient having IgG positive.
Right.
Hmm.
So what's the question? So this
Question is
patient,
that one, doctor, do I have whether I'm infected about I'm
Oh,
infected
yes.
with hepatitis B?
Oh yes, then you can explain to him that you might have been, but now you have immunity. So you are. So we don't know. He's been given vaccination before, or he has been having this infection before. So he's immune now.
He never knows about anything. Then
I don't know, to be honest. I don't
okay,
understand.
doctor. Okay, anyone else, doctor?
I don't understand. I mean, what is the
IgG positive means that there is immunity already
Yeah,
in
so it
Okay,
could be
but how you are
vaccination,
going to confirm,
post-prophylaxis.
doctor? How are you going to confirm? There is
Sir,
one
have
more
we will
to
test is
do the
say
there.
T
that
test,
your IgG is
HBs
positive,
antigen
but we
first.
are not sure that you are having an acute infection. So for that, we have to do an IgM to make sure you have the acute infection.
And what else, doctor? There is one more test is
There
there.
is some. May I talk if you
HBs
allow me?
Yes,
antigen.
doctor. Yeah, doctor.
Surface
Actually,
antigen.
No,
IgG.
for acute infection, the surface antigen should be checked.
There are 3 levels: 0 to 10,
Yes,
10 to
doctor.
100, and
Surface
more than
anti.
100. There are 3
Yes, doctor.
levels are there.
That will be there, Doctor Iqbal. But doctor, just now one doctor told about surface antigen.
Surface antigen is the
Okay.
marker to check. There will
Is
be
acute
either
infection.
antigen or antibody.
Yeah.
Yes, exactly.
One of
That's
the
what.
two.
Active
Or E.
infection. Yeah.
Or E,
You
yeah.
know, yeah,
It's
doctor, I'm telling you, this is one of the best answer I got from doctor, I think Dr. Saima. Okay, the reason because of hidden agenda of this case was in orientation program to whether you are breaking the news about the patient that you have hepatitis B or what. Okay, so second agenda was how you are going to tell the patient for the precautions. Patient is a barber. How are you going to do it? Okay, I will give you one more scenario because I have 4 to 5 minutes for the talk. Then I have to run for my duty. Okay, this scenario was that you have to go for surface antigen and you have to explain patient precautions if patient is a barber. Second scenario, they given us and it came in the exam multiple time, doctor, that this is a kind of breaking bad news. What happened? I am having this positive report with surface antigen positive and this everything positive, but I'm coming to you, doctor. Don't tell my employer, otherwise I will lose the job. What you will do? Patient is a barber. Patient is a barber.
Okay.
Or working at salon.
Okay, so as a general rule, which I know, that before we can't break the confidentiality for the patient. We can't tell the employer until he gave us a consent. So we encourage the patient to tell himself to his employer. We will discuss. We will encourage.
But employee came with him now.
So again,
he's sitting outside.
We can't unless we have a full consent of this patient. We can't break the confidentiality.
Dr. Jahid, if other people's health on stake, on risk,
yes,
then
exactly.
You must.
We have to break, doctor.
This is the
Dr.
only
Shahid?
in HIV case. in HIV
No,
cases.
no, doctor. This is also hepatitis B. Also is the same. In a way, we have to tell the patient that this is a patient is involved because now he's working with the sharp items. Okay, barber, he's working in the salon. He's using the blades. Okay, he's involved with other people that doing the shave and other things. Doctor, how you going to say he will be the one? He will be the one. You know what you call it, vector for to spread everywhere all across.
So, for example, I mean, what you're saying that we need to tell the employer, yeah?
Yes, yes,
Okay.
yes, doctor.
We need
As
to
per
go through
local,
this again
yes,
because which
doctor. Yes,
I
doctor.
know the patient
Because,
confidentiality is utmost important unless
wonderful
he
thing,
give a
doctor.
full
I
consent.
100% agree. When they take off other patients' health, we have to break the news. Like yes, if this patient is not working anywhere, yes, we cannot share it with anyone. We have to tell, okay, you have to use contraceptive or barrier method while relationships. Okay, you should not use the share. You should not share your blades. You should not share your knives, anything. And whenever there's a sharp items are there, please be careful. That's it, doctor. But the thing, when patient is involved in a such profession where the stake of others' health is involved, we have to break the news.
Okay. Number two, I know you're short of time, but just quickly, again,
Yeah,
it's a similar scenario because of the, for example, STIs. Okay.
yeah,
Now
yeah.
the person, he doesn't want to tell his wife because
Hmm.
he was being naughty. Okay, so he was abroad and he did something wrong. Now he got infected. So in that scenario, what should we do? I mean, he doesn't want to tell his wife,
He
and
have to tell his
she
wife.
can
Now we
get
have to
that
convince him.
STI. So how we shall we tell the wife without his consent?
Doctor, I have to go now because my time is short, but I will be
Sure, sure.
answering
Thank you,
I will be
thank you,
answering. I will
Imran.
be
We really
answering over
appreciate.
there. Okay.
Yeah, we
Thank you very
really
much.
appreciate your time. Yes, so you're
Thank
very
you very much.
kind.
Thank you.
You're very
Thank
kind.
you very much.
Thank you. Thank you
Thank you
so
very much,
much.
doctor. Thank you.
Thank
Bye
you.
bye.
Bye bye. Bye bye.
Bye bye.